So let's talk about lactose deficiency or lactose intolerance. Lactase deficiency will cause lactose intolerance. So this is the clinical significance here. When lactase is deficient from the birth, it is called congenital lactase deficiency, congenital lactose intolerance. But normally we see lactase deficiency happens as we progress through our age, and this age dependent deficiency in lactase is primary. This is normal, and this is why this is called primary. And then when this lactase deficiency happens because of some infection, some disease, for example, you can see gastroenteritis. What will happen? The epithelium, brush border epithelium, that will be lost. And because of loss of this brush border epithelium, enzyme will also be lost. And this is called secondary deficiency. This will lead to secondary deficiency of lactase. For example, in rotavirus infection in children, an autoimmune disease, certain autoimmune disease will cause this problem. So this is secondary deficiency is because of disease. Primary is because of age, and congenital is because of genetically deficiency. So congenital, you have to understand the after the baby gets birth, when baby is fed with mother milk, baby is not able to digest. There will be bloating with baby intestine. So there will be difficulty in digestion. Vomiting will be there in the baby, and that signals that the baby is unable to digest lactose, because baby is congenitally deficient in lactase. And in such condition, you'll have to give what? You'll have to give lactose-free milk to baby. You'll have to give lactose-free milk to baby. So this congenital condition is because of defective. And you can see what is the problem here. Finding will be bloating, cramps, flatulence, osmotic diarrhea. So in baby, there will be diarrhea and then vomiting you will see in baby. Flatulence, the pain will happen and baby will cry. Okay, baby will cry. There will be cry in baby, and then bloating, vomiting can happen in baby. So these are the presentation you will see in baby, but the adult will actually complain you are bloating, cramps. So this complaint will come from your adult. What is the treatment? Avoid dairy product. Add lactase pill. You supplement lactase, and then avoid this dairy product, and to baby give lactose-free milk. So these are the avoid lactase. Avoiding lactase is the treatment. Now what is the test that is done to find out this disorder? So you can see when you do the pH testing in stool, so stool will have low pH. Why? Because lactase will be digested by, will be done fermentation by anaerobic bacteria that is present in your colon, and it will be changed into acid, acetic acid. So because of this acetic acid, stool will have low pH. So pH will have, your stool will have low pH, and the breath test is done. Very famous hydrogen breath test is done for this patient. So I will tell you what is hydrogen breath test in a short while. So hydrogen breath test and pH, you test the pH of stool, it will be low. So this is all about lactose intolerance. 3 types of lactose intolerance. First is primary because of normal aging process. Second is because of disease, and congenital because of congenitally deficient lactase. In all conditions, avoid lactose and give lactase pill. In baby, because a newborn baby, he or she does not have any choice other than milk, so supplement with lactose-free milk. That is the treatment of choice. So these are all about lactose intolerance. You can see dietary lactose intolerance, you already know this, because of enzyme deficiency. And lactase function on brush border, you already know this. Digest lactose in human into glucose and galactose, you already know this. Okay, so lactose hydrogen breath test positive for lactase malabsorption if post lactose breath hydrogen rises above this. So this is 20 ppm. Remember, you can see this is this picture I have taken from here, so that you can go to flatulence, you can see nausea, vomiting, stomach ache, and then you sometimes the bacteria. This is like when disease secondary to disease, it can happen secondary to disease, or it can happen hereditary. Secondary to disease, sometimes what happens, even if you take antibiotic, the antibiotic cause death of good bacteria inside intestine, and abnormal bacteria will grow, and it will cause your diarrhea to the intestine, and that will also cause brush border, that will affect your brush border and lactase. Because of that, this lactase intolerance can happen, secondary lactase intolerance. So you can go through. So these three type of test you can see: lactose intolerance, hydrogen breath test. We will talk a little bit after this. So here you can see this elimination of, so you eliminate this lactose free diet, do it yourself, eliminate lactose free diet and check it for few weeks. If you are okay, then you must have lactose intolerance. This is a simple things that you can do yourself, do it yourself. Okay. Second is that you give a lactose to patient. Okay, glucose level is measured. Okay, so what you do is you give at 30 minutes, at 60 minutes before consuming lactose. So give lactose to the patient, and if you give lactose, what will happen? It will go into the intestine, and if it is normal, the normal patient, what will happen? The lactose and galactose, glucose and galactose, it will be converted to glucose, galactose, and it will be absorbed into the blood, and you test for glucose. You test for this glucose, blood glucose level at 30 and 60 minutes. If glucose level you find it rising, then you will see, okay, this patient is not having lactose intolerance. So this is indirect test you can do easily. And this is breath test is more important for lactose intolerance. What you do, you actually prepare the patient. You tell the patient not to have anything for 12 hours at least, and then come to your laboratory. Then what you do, you give this solution, lactose solution, to the patient. Okay, after you give, before you give lactose solution, you take one sample of breath, one sample of breath, and then you will then after taking this, you take the breath after each 30 minutes up to 13 hours. So you will have many test tubes like this here. I'll show you. Many test tubes like this. Before taking lactose solution, you ask the patient to breathe, and you put this test tube here inside, and this actually test tube will be pierced by this. Here is the piercing needle, and the breath will go inside this. So this is how sample is collected. And why breath comes from lungs, but you have seen that you need to take breath. So what will happen is this hydrogen, the digested product, because of fermentation, this hydrogen gas will go into the circulation, and from circulation it will reach lungs, and that is why from lungs you can take this hydrogen breath like this. So this from lungs, hydrogen breath can go to the air. So this is how hydrogen breath test is done. Sample is collected and hydrogen breath test is done.